Today we're having Dr. Diane Kruger speak to us. She graduated from the National College of Chiropractic after attending the University of Iowa. She is also a specialist in Chinese medicine techniques, including acupuncture, as well as acupressure and other Chinese healing philosophies. So I think we had that in common. We should have chatted more about that the other day. Besides being a doctor, she's also a wife and mother, and uses that experience as well as her vast practical experience in her practice, specializing in women's care, especially that of pregnant mothers and pregnant women and new mothers. And she really specializes in natural approaches to prevention and dealing with the problems of women's care throughout their entire life. Her work has been published in the Journal of Manipulative and Physiological Therapeutics. So if you'll join me in welcoming Dr. Diane.
The reason Toddler said that is because she spent 5 years in China and she speaks Chinese, which I think is fascinating. So thank you so much for welcoming me. I appreciate that introduction. I am Dr. Diane Krieger. I've been a chiropractor since 1985. Has anyone here never experienced chiropractic care? Raise your hand, don't be shy. Everybody has?
No, nobody.
Not you, not you. Okay, good. Well, someday, it's never too late. But if you have questions about that, I'd be happy to talk to you. I'm here today to talk to you about strategically aging, how to age well, and how to not be bothered by your body, and just have a very healthy life and not have to take a lot of medicines and be bothered with certain diagnoses and surgeries and treatments and things like that. That is usually what most people want in life, is to live life freely without those kinds of things. So when we talk about aging, the word inflammation comes to mind. Maybe not for you, but for me it does. Inflammation is where it's at. It's the common buzzword in society these days. If you have something going wrong with your body, you have inflammation. If you're overweight, you have inflammation. If you have any kind of disease, you have inflammation. If you have heartburn, something's inflamed. You know, if your elbow hurts, something's inflamed. If you wake up and you can barely walk because your feet hurt, something's inflamed. So we're going to be talking a lot about inflammation and what you can do to help lessen the inflammatory events in your life. And that would have to do with things like how you eat, how you sleep, things like that, how you manage your stress, all that kind of stuff. So well, let me tell you a little bit more about myself, because I guess I skipped over that whole area. I'm going to get right into the meat and potatoes here, so to speak. Meat and potatoes, are they on the food pyramid? That's a good question.
Yeah.
I have 3 kids. They were all born at home. I'm really kind of one of those natural freaks, so I don't like to be in the hospital. I think hospitals are for sick people, and pregnant women aren't sick. So I had my kids at home. They've not been immunized. I can now publicly say that. And 20 years ago, though I couldn't tell people that, they thought I was a bad mom. And they're very, very healthy. And they've, been great chiropractic products. They're just, they use chiropractic care for their health care. They don't take aspirins or Tylenols or anything like that. So there's all sorts of natural things you can do in lieu of the over-the-counters as well. So my husband, I told you my husband and I met in college. We're still together. We work together. We both practice together, and we haven't killed each other, which is really good. And all 3 of our kids are certified chiropractic assistants, so that's kind of fun. I'm also an acupuncturist, as Toffler has said. I've been doing acupuncture since 1985 as well. And as a hobby, I have chickens. I'm like a frustrated farmer at heart. I have chickens and I have a garden and things like that. So because this event is happening in a library today, I thought it might be fun to recommend some reading material for you guys as I'm going through certain topics that would support what I'm saying if you're interested in having more information on that. So one of my favorite things to read personally is actually not a book, it's a magazine, and it's called Backyard Poultry. So they're really, really fun, great pictures. So anyway, now we're going to go back into our inflammation. How can you find out if you're inflamed or not? Well, there's a lot of different ways. You can do lots of lab tests. One of the things that people oftentimes have tested regularly are their cholesterol levels or their body fat, their blood fats. If your triglyceride over your HDL ratio is more than 4, you are inflamed. So all you do is you find out what your triglyceride number is and divide it by your HDLs, which are your good cholesterol. And if it's more than 4, you have inflammation in your body. There are two kinds of inflammation. Silent inflammation, which is where you don't feel anything, you don't have any symptoms. And then there's screaming inflammation, which is where my patients come into me and go, ouch, my back hurts. So silent inflammation is where you have, it's an accident waiting to happen. It's a problem waiting to happen. So we want to get into the prevention of what you can do to help prevent the inflammation from getting out of control and you ending up with a diagnosis or something like that. So the triglyceride over HDL ratio is one way to measure inflammation. Another way is to measure your body fat percent. Has anybody ever had their body fat percent checked? Okay, good. So there are normal values for different sexes and for different ages. So a woman that's 50 will have a different fat percent as a normal value versus a man that's 50, because women tend to carry more fat than men, and that's the way it's supposed to be, because we're special. And we're going to get into the body fat testing in a minute because I want to give you some case studies that are very interesting. Another good way to measure inflammation is waist circumference, believe it or not. Guess what your waist circumference is supposed to be when you're a woman? What do you think? Anybody have a good idea?
34 inches.
35 or less. So I can pass this around if anybody's interested in checking. Just make sure you're in good range. That would be good. Guess what it is for men?
36.
40.
40?
40. Mm-hmm. But now let me tell you, you have to measure around the biggest part of your belly. You don't get to measure around the skinniest part of your belly. Usually I usually go right for the belly button and go around because that's usually where it's at, but some people are built differently, so go around the biggest part of your belly. Now this is a statistic from the American Diabetic Association. They say if a woman has a waist circumference of over 35 and if a man has a waist circumference of over 40, you are going to have blood sugar problems and be a potential type 2 diabetic in the future. Mm-hmm. So another way to measure.
If you don't have any waist, you just
You know that happens. That does happen. Just guess. Measure anywhere then. Just
belly. Oh no.
So that's just something fun. You guys can play around with it if you'd like. You can pass that along if you'd like. Just make sure you're in good range there. That's a smart thing to do. I'm going to go back to body fat. I'm going to go back to body fat because we just mentioned it. And I have a lot of things to talk about. I'm afraid I'm going to forget something. But let's say, for example, let's play a guessing game. Guess what percentage is ideal for, do you want me to use you as a subject, as an example, or are you too shy? How old are you?
79.
Okay, how much fat should he be carrying as a 79-year-old man? What do you think? What percentage fat would be healthy for him? Anybody have a good idea? A healthy body fat percent.
21, 22.
Very close. 17 to 20 would be ideal. If you're 79 to 21, I would be impressed. I'll tell you that. I would be impressed. Anybody else want to know what a normal range is for? How about you, Toddler? You're a woman that is how old?
29.
29. So you're almost 30. We'll say a range between 20 and 37. Oh, tell me what you think. I almost gave it away. Sorry. What do you think a good range for a woman your age should be?
Between like 17 to 28%?
17 to 21. Yep, to 21. So different men and women carry different ratios, and for different ages you get to carry different fat percentages. So I'm going to tell you a story because a lot of inflammation has to do with what we eat, right? Is that what most people have been thinking? What do you eat to reduce inflammation, right? If you're really interested in that, I have a whole list of the foods you should avoid if you have inflammation, and it's all the anti-inflammatory foods. So for example, fruits. Oranges are inflammatory, believe it or not. Oranges and orange juice are inflammatory. So then in the next column it gives you recommended alternative. In vegetables, corn's inflammatory. And the nightshade vegetables can be inflammatory. Those are your potatoes, tomatoes, eggplants, peppers. So your alternatives would be other vegetables than those. So, and it gives you the whole list. Wheat is inflammatory and so on and so forth.
So oranges are?
They actually can be inflammatory. So you can test them. You know, it's easy to food test. You eliminate that food for a month or two and then you reintroduce it. And if you reintroduce it one day in a big, huge amount, you can see if you have a reaction. And
Is
it's
it the acid in the juice?
you know, if it were that, then I wondered about why grapefruit's not on the list, you know, so,
Yeah.
you know, I'm not exactly sure why. That's a good question, and I'm sure some book in this library would tell you.
So it could be like an intolerance then, rather than...
Some people have food intolerances. I mean, we get into the whole gluten sensitivity, as everybody's heard of gluten, right? The studies are showing that a good percentage of the population is gluten sensitive. It doesn't mean they have a full-blown allergy to gluten. That would be celiac disease or tropical sprue, where if they eat gluten, then they get really sick. It would just be a sensitivity where it maybe creates some body inflammation or some joint inflammation or some non-optimal situation. Maybe their sinuses fill up or some kind of allergy to that. But the problem is the wheat here is not the same as the wheat in Europe. You know, some people who are gluten sensitive here may not be gluten sensitive because of what we do. And there's a company out there called Monsanto that no one really likes. So they keep bastardizing our food sources. So at any rate, if you're interested in the anti-inflammatory food list, it's going to be up here, and you're welcome to take a look at it. So I'm going to talk about, I do a program at my office called First Line Therapy. So it's a program that helps people manage their body composition. So when the patient first comes to me, I check their body composition with a machine called a bioimpedance analysis machine. And I put electrodes on the foot and ankle and on the hand and wrist, and the person lays down, and I plug into the computer their age, sex, height, and weight. And then the machine runs a charge all the way up and down the body, and it tells me their internal organ fat as well as the fat everywhere in their body. But it also gives me other information. So it tells me how well hydrated the person is, how many calories the person's burning, what their phase angle is, which is an important number, and we can get into that later if you're interested. But I'm going to tell you about a woman that was 63 inches tall, so that's 5'3", right? So she's 5'3". She weighed 100 and, let's see, this is February, yeah. She weighed 112 pounds, so she was teeny. Her wrists were real teeny. She was a very thin-boned lady. She came to me because she went to a gym and somebody told her at a gym, hey, you have a high percentage of body fat by one of the type of tests that they do at the gym. So she came to me to do the fancy test to see if it was true. And she looked very healthy. She was very petite. She was 32.3% body fat, believe it or not. Now, who would have expected that? That's what we call a skinny fat person. So it's a person who looks very lean, but is actually very fatty, and that's dangerous. She also had hormonal problems, couldn't get pregnant, things like that. So I put her on a program, I told her how to eat. Basically her situation was, she was a grainitarian. She lived on bagels and muffins and things like that. She ate very little protein. So I coached her and helped her learn how to eat protein with every meal and extra protein for snacks and things like that. So that was in February. At the beginning of February, in the middle of March, she lost 2 pounds, so her weight went down to 110 pounds. That was fine. We weren't doing the program for weight loss at all. We were doing it because of her fat content. Her fat went to 24.2%. From 32 to 24. That's a huge drop in just about a month, in about 5 weeks. So how you eat has a direct impact on what you see in the mirror, and also what you don't see in the mirror, which is the internal organs. And things like that. The fat that's stored around the internal organs is the problem fat. People go and get liposuction and they say to me, oh, I had to do a dump because I was worried about my health. Well, the fat that you can grab doesn't really have a terrible impact on your health. It's the fat underneath your abdominal muscles, around your internal organs, that has the bad effects on your health. So it was kind of interesting. But, yeah. So, any questions so far?
Fascinating.
On that kind of thing.
What's the 50-year-old woman's?
50-year-old woman should be 20 to 23. So let me tell you, any man should, no matter how old, should never be over 20%. And any woman, no matter how old, this chart goes to 80 years old, should never be over 25%.
Now this is the internal fat that's around.
This is the fat, the whole body fat.
Whole body fat. Okay.
Now you'll read different references. Like here's another reference that I pulled out of a magazine, but they even say that women at for a man, they say excessive fat is 21 to 30%. For women, excessive fat is 31 to 40%. Moderately lean is 23 to 30%. This is out of a magazine. I don't agree with this. This is I don't agree with some of the things I read. So you have to, when you're reading and researching, you have to, be watchful and wary and, figure things out. Ask questions and read more and figure out what's true for you. So, so that's about the body composition test that we utilize to also talk to our patients about what they can do about their high fat percentages. So when I talk to patients about how to reduce that fat percent, it has to do with basic eating guides. The big one is eating every 3 hours. If you don't eat every 3 hours, your body starts to store fat. That's the best thing to do to balance blood sugar too. There is a guy that recently wrote a book called The Blood Sugar Solution. His name is Mark Hyman. And if anybody has knows somebody with diabetes or has been told they're pre-diabetic or whatever, they should look at this book. It's called The Blood Sugar Solution. He's a medical doctor. He also wrote Ultrametabolism, and he also wrote the Ultramind Solution, or the Ultramind Simple Solution, or something like that. Really great doctor to read up on. But he is taking type 2 diabetics and giving them a certain dietary program, and in 7 to 10 days they're not a type 2 diabetic anymore.
Wow.
So it's very, very interesting. It has everything to do with what you put in your mouth.
Even after taking insulin?
Well, that's the trick. I don't know what he's doing yet. I don't know what he's doing.
Depends on how severe it is.
Exactly. I would like to tell you a little bit about how diabetes occurred, and then we'll get back into that. But this is the diabetic prevalences, and these are just arbitrary numbers. I guess that should probably be a 30, and this should be a 40. But at any rate, in the 1940s, that's when the American Diabetic Association was found. In 1956, they really bumped the sugar up in cereals. In 1966, they started mass-producing French fries. You can see this is, slight incline. Value meals started in 75. Now in 1984, something big happened, right? Because look, right after this, a big jump. So this is when the soda formularies changed from plain old sugar to high-fructose corn syrup.
I thought that's when Starbucks.
Maybe. So big jump here, and then in 1992, this little pyramid stands for the food pyramid. When they put grains at the bottom of the food pyramid, they were telling people to eat like 10 or 11 servings of grains a day. I don't know, it was absurd. And kids are still taught this food pyramid in the United States. It's wrong, 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 wrong. I heard, and I don't know if it's true, that 8 out of 10 of the people that came up with this food pyramid had a vested interest in the grain companies. And that would make sense, right? But when they put grains at the bottom of the food pyramid and everybody was eating bread at every meal, another huge jump in diabetes. So you have to look at your sweeteners and look at your breads and your grains and make sure that those things are managed well in your diet, meaning no high fructose corn syrup and very, very limited grains. And then you should have a pretty stable blood sugar. And then in 1995, metformin came about. That's a diabetic drug, and then insulin sales reached 3.4 billion in 2005. So I thought this was just intriguing, and you really have to see, I mean, when this food pyramid came out, people started getting shaped like the food pyramid. It's very dangerous. Grains belong up here. This is where they belong. What do you guys think belongs down here?
Fruits and vegetables.
Vegetables, lean proteins, fruits, water, nuts and seeds, healthy oils, things like that as we move up. Correct. So what's really interesting is I have a lot of patients that come to me as vegetarians, and I check their body composition out. And oftentimes they're super fatty because they're not really vegetarians, they're grainitarians. They're eating way too many grains and not enough vegetables and really not figuring out very well how to get their protein in their diet, and that can be a problem. So it's very tricky when people are vegan or vegetarian to make sure they're getting enough protein, but it's nice to have it tested so you can make sure that you are doing your diet right. Because if that's the way you want to eat, just want to make sure that it's doing your body good instead of doing your body bad. Okay, so we talked about some foods that inflame, waist circumference. The other thing that will help decrease body fat mass, one is eating every 3 hours. The other thing is omega-3 essential fatty acids. Those are your fish oils. Those really help decrease that fat mass. The more fish oils my patients take, the faster that fat mass goes down. It's very interesting. You'll see some products that have omega-3, 6, 9. You don't need the 6s and the 9s. We have enough of those in our diet. We have too many of those in our diet. You just need the omega-3s. So when you're buying fish...
It's better for the natural, is it, instead of the manufactured
Omega-3s?
omega-3?
I don't know about any of the manufactured ones. They're
What
usually...
about pills?
Yeah, they're usually a fish source, but you don't... You have to be careful about your omega-3 fish sources, because if you're buying cheap fish oil, you're getting what I call low-grade fish sewage sludge. Because there's good fish oil and then there's bad fish oil. You want to get a good fish fish oil that's been tested and third-party tested to make sure that it's pure, because you don't want a lot of mercury, PCBs, dioxides in your fish oils, because that can create all sorts of other problems, right? So you want a good fish oil. I don't trust when my patients say, I bought this, gallon of fish oil at Costco, and I'm like, ugh. I worry, So you do want to be careful of the fish oil that you get. Yes?
Have you heard of omega-7s?
I have not.
Okay.
Interesting. I'd be curious though, so let me know. Are they good or bad?
I don't know. That's what I was hoping you were going to say.
I have not.
But they're numbered 7, they should be good.
I don't know. I have heard lately a lot about Alzheimer's becoming reclassified as type 3 diabetes.
Yeah, really.
Now think about that. That's a very interesting concept, because if you have blood sugar imbalances that are affecting your brain function, you could obviously get a dementia type of state going on. So type 3 diabetes is probably something you'll start to see in the media someday.
I was going to ask you, I've heard that fish oil omega-3 helps when there's mental illness in the person.
The DHA is, absolutely. Yeah, they're using it a lot with children too, especially the DHA for kids with behavior problems and things like that. So, yeah. Okay, so the other test of inflammation is just to look at somebody. I mean, you see a lot of guys that walk around and they have breasts. That's inflammation. That's an endocrine abundance in a guy, and it's not healthy. I mean, I see guys that really should be wearing a bra, I mean, it's bad. It's really scary. So that's a big sign of unhealth as well. Now, the other thing that can stress us out and create more inflammation in our body is not the right kind of sleep. So how much sleep should we get? Anybody have a good idea?
7 to 8 hours.
Okay, anybody else have a good idea? The magic number is usually 8 to 8.5. So less than 7 is bad, more than 9 is bad. Around 8 to 8.5 has been what's shown to be ideal. The benefits of that are, going to be good energy, better blood sugar balance, better, healthier body composition, mental health, all that kind of stuff. If you sleep less than 7 hours per night, you have a greater risk of type 2 diabetes, hunger, weight gain, depression, stress, heart disease, slowed reactions, inflammation, things like that. If you sleep more than 9 hours, your chances of being exhausted are greatly enhanced. So if you meet someone that's exhausted, see if they're sleeping more than 9 hours and suggest they sleep less, and they will not probably have that much exhaustion. It's very interesting. That's very true. And again, with more than 9 hours of sleep, another increase in your risk of type 2 diabetes, insulin resistance, exhaustion, depression, things like that. So sleep is very important. If you don't get enough sleep, that could be causing more inflammation in your body. Then you won't age as well as you should.
How about for teenagers? If they sleep more than 9 hours, is that?
I know there's that teenage conundrum. I have three kids that are that age, and they can sleep like 12 hours at a time.
Yeah.
That's a good question. I don't think they need that much. I know. What's that?
I think like they're growing. They
Yeah, I know.
puppies or something.
I do think they need a little more sleep, but I don't know if they need, that much.
Because they seem grumpy throughout the day too. You're like, I know it's all their hormones crazy, but still you're like, oh, maybe you're what you were saying, a little less sleep would make them a little less, they seem like they still need more
It's
sleep.
possible, and you always have to look at their diet, because they're hungry all the time, so they rely on a lot of different kinds of foods that are probably not that great.
Empty.
So, what's that?
Empty calories.
Right. So, we talked about sleep and we talked about body fat. We're going to now talk about what can stress certain glands in your body and create inflammation in a glandular sense. Has everybody heard about the adrenal glands? They're glands that sit on top of your kidneys. They're responsible for good energy function. They create a release of cortisol, which is a stress hormone, and things that can stress the adrenals are three things. Three things stress the adrenals. Blood sugar. We talked about ways to manage that by eating every 3 hours and watching the types of foods that you eat. Mental stress or emotional stress can stress out the adrenals. And lastly, inflammation. So if you have body inflammation going on, it can stress the adrenal glands. So has anybody ever tried to boost their adrenals by taking a remedy or anything? No. It's very common for people to try to manage their adrenals by doing certain things nutraceutically. And when I say nutraceutically, I mean not pharmaceutically with a prescription, but with a natural product like a vitamin or a herb or a nutritional supplement. So mental emotional stress can be all kinds. It could be anger, fear, death of someone, a loved one. It could be a marriage problem, relationship problem, jobs, financial worries, divorces, birth of a child, personal injuries, illnesses, things like that. All those can be mental and emotional stress. And so you want to figure out a way to manage that stress.